Yeah, my name is Jurre van Kesteren. I'm a resident general surgery, and this is a photo I took in Sierra Leone. And I'm setting up a research project on video-assisted learning on a surgical residency program in a low-resource setting. Before I became a resident general surgery, I was I still am, a global health doctor. And in that capacity, I worked in Sierra Leone for 2 years in Masanga Hospital, where I did clinical work, but I was also involved in the support of a surgical training program, of which you can hear more in the on-the-job session. It's the Kappa Care program. What struck me and what I still find striking is this graph that you see over here, that if you want to achieve a minimum standard of or acceptable standard of care, then you need at least to have 20 mixed surgical workforce per 100,000 population. That means that you need to have a combination of surgeons, obstetricians, and anesthetists 20 times per 100,000 people in your country to at least serve an acceptable range of care. If I look at Sierra Leone, where I worked for 2 years, the number is 0.15. So that is far, far out of the 20 that you need minimally. And that's made me wonder, like, how can you get a higher surgical workforce? Or how can you have more surgeons if there are hardly surgeons that can function as trainers for the surgical residents? So how do you train certain surgical residents in a tutor-scarce environment? That's actually the question. If I look back to Sierra Leone, where I worked, we used a master-apprentice relationship. So you had a surgeon coming in from Scandinavia or from Europe, from the Netherlands, training the residents over there. And we used textbooks. But you see more and more innovative tools coming up. Massive open online courses are coming up, e-learnings are coming up, video-assisted learnings are coming up, which you can hear more about in the off-the-job session. And I was wondering, is it possible to use these innovative tools in an environment as where I worked before? So I was wondering, is it possible to check how somebody is performing? Can we document how somebody is doing a surgical procedure? So I went back to the hospital in Sierra Leone. We made this setup, and actually on a very low cost, we developed, after a lot of trial and error, videos that have these kind of clear images. So you don't need to have thousands of euros of equipment to do proper recordings. And our idea now is to analyze these recordings, to make baseline videos of the surgeons that are in training in the project that I worked before, expose them to a platform that offers a video-assisted learning, and then afterwards we will check how they have improved or how they have used this project. That's the first project I'm working on, and if you're interested as a student or if you want to know more about this project, please come to me during the breaks and we can have further discussions. The second project that I'm working on together with Matthijs and Jochen Bredsnijder from Medical Learning Experience is Library of Global Surgery. And that comes out of a presentation that was actually held in this hall in 2014 when the Amsterdam Declaration was signed. 70 organizations signed in 2014 that essential surgical care should be put on the agenda. And with essential surgical care, they actually meant 15 to 16 surgical conditions that account for around 80% of the surgical burden. So what we have done now is that we said, okay, these 15, 16 medical conditions, let's put them into an electronic environment. Let's put them in an e-book. And initially we started with the iBook together with Medical Learning Experience. And we used the concept of one world, one standard of care. We use the international guidelines as a base for these books, and we adjust the books on modern times. So we involve, we input video learning into this project. What you see here now is the first concept of the hernia book that we have worked on for the last months. All the books have the same layout. So you have a direct overview where you can have your congenital, elective, and acute problems. You directly tap on it, you go to your next page, and then you see a horizontal bar and a vertical bar. And if you look at the vertical bar, there's different symbols, and they correspond for different stages, for example, general information, anatomy, anamnesis, a physical examination, differential diagnosis. And on the screen, you see 4 bars horizontally, which stand for the recommendation, but also evidence-based and level of evidence. And we say that even if you work in a low resource environment, it should not be without evidence. So we still believe that we should put evidence in our working books. Then we work together with 3D for Medical to make interactive models in the books, and we want to include videos. The current videos that we include are the videos that we shot ourselves in Sierra Leone, but we're looking for partnerships with organizations or companies that are willing to collaborate and put their videos in our books. And also for this project, if you're interested to join, please come to me and we can discuss further. Thank you very much.